Great. So welcome and thank you for joining us today. We want to start by wishing everyone good health and your families, and then anyone close to the hurricane. We hope you're staying safe and well. We appreciate that you've taken the time to be with us today as we talk about getting started with 21st century cures. On today's agenda, we're going to start at the beginning with where do I start? We'll talk about your expectations to updating the cures, compliance requirements, timelines you should be aware of. We'll have a few examples of different scenarios if you have certified to the 2015 edition, and those for those that have not certified yet and want to get certified to cures. We'll then give a brief update on real-world testing, and we'll wrap it up by taking a few questions at the end. I'm your host, Melissa Martin. Our speaker today is Sonia Galvan, who runs our certification program. And behind the scenes answering questions submitted during the webinar is Heather Kelty, who is one of our account managers and test proctors. There is a Q&A button on your screen to submit questions during the webinar, and Heather will be able to get to those during the presentation. And then at the end, we'll answer a few questions live. Any questions not answered during the webinar will be answered directly to you via email. As many questions as you'd like, and we'll either get to them today or we'll get to them as quickly as possible. This presentation is being recorded and will be sent to you within the week, so don't worry if you miss something. We know there's a lot of information, and we have some links in here that might be useful for resources. So we'll email you the link to the recording and we'll post it to our website. So with that introduction, Sonia, let's talk about how to get started with cures and where do I start?
Hi, good afternoon, everyone. Thank you for joining us. So today we're going to be discussing how to get started with the cures certification, how to register, what the process is going to look like. So we hope you find some needed clarifications today. So to begin with, Health IT developers should prepare for this cures certification. We've listed some resources that you might find helpful. For those downloading the slides later today, these are active links, so please take a look at these resources. So first, developers should review the ONC's 21st Century Cures Final Rule. It may be a lengthy read, but certainly well worth it to understand the reasoning behind some of the changes and providing further insight into the requirements, especially surrounding information blocking. Also, the Cures has designated a new web page, so it's the ONC Cures Rule page. This contains ONC's webinar recordings, frequently asked questions, timelines, and overall it's a good resource for Cures guidance. Also, refer to the ONC Cures test method. This contains the test procedures, standards, requirements for the new and revised criteria. For Drummond clients, you have access to our customer portal, which we are gradually adding to, including a new knowledge base, FAQs, guidance on testing and certification. You're also able to get support tickets for any technical questions you have. Also, if you visit our website at drummondgroup.com, you'll find a series of webinars that we hosted over the past couple of months covering specific subjects such as conditions of certification, testing criteria, and real-world testing. You'll also find newsletters and blog posts that we think you might find helpful. So Drummond has finalized test scripts, which are also referred to as our proctor sheets. These were designed by Drummond to help make the testing process more efficient and provide clarifications and guidance for developers. These are very useful even as self-testing criteria. So for Drummond clients, you will be able to access these tomorrow by logging into our customer portal. Additionally, we are creating a roadmap to assist developers in determining their specific path for planning, cures, testing, and certification. So the roadmap will be released soon, and developers will be notified by newsletter announcement once that's ready. So as you can see, we are working hard to try indications and guidance as you navigate through the very complex new rules. So we encourage you to continue asking questions and submitting those to us. So we want to provide an overview of what to expect in terms of the testing and certification criteria. So this table, it summarizes the 2015 Cures update. Later in the webinar, we'll discuss the process to update your product. But for now, we'll take a look at the criteria. So we have 4 new criteria that were introduced as part of the Cures regulation. And these are required to be certified by May 2022, with the exception of B10, which can be certified up until May 2023. So for B10 EHI export, this criterion will need to be certified for products that store health information. And we anticipate this to affect a good portion of our developers in the audience today. D12 encrypt authentication credentials and D13 multi-factor authentication are new privacy and security requirements. These will apply to nearly every product. So a developer, when a developer is submitting attestation that results in a new chapel listing, or a developer wants to update their current product chapel listing, you will need to complete an attestation for this new criteria. So again, D12 and D13. So you're not required to implement these new capabilities, but rather you will be required to attest yes or no whether you support them or not. For G10 standardized API, this criterion is replacing the G8 API data category request. So this is expected to apply to any product that's certified to API criteria. It's also a requirement for the condition of certification, known as API, and also is part of the ONC-based EHR and the CMS EHR definitions. Revised criteria, so these are required to be updated by May 2022. So some of the revisions include updates to USCDI for the CCDA-related criteria, supporting CMS QRDA implementation guide for CQM reporting, and other changes building upon existing 2015 capabilities. Time-limited criteria, these will eventually be removed from the ONC program, some starting in January 2022. So if you're currently certified to any of these under the time-limited criteria section, there's no action needed at this time. Just be aware they will eventually be removed. So for those criteria listed under the removed, obviously these have already been removed effective June 30th. If your product was certified to any of the criteria under the removed section, please be sure to remove any reference to those criteria from your website and marketing materials. And then finally, the privacy and security framework. So aside from the new D12 and D13 requirements, the framework has some other minor updates, which may require new privacy and security dependencies for some products. So please take a look at these, especially when making updates to your product. Table is available via the ONC test method page, and a link is available here as well. This next table summarizes the conditions and maintenance of certification, and we've tried to identify which developers will be impacted by these specific conditions. So the first condition is the information blocking. Yeah, so this is a primary theme throughout the Cures regulation. So consider it to be applied to all Health IT developers. Okay, so all developers should be impacted by the information blocking condition of certification. And this actually also includes other actors such as health information exchange, providers. So if you have not already done so, please take the time to review the final rule regarding information blocking. It discusses exceptions to that rule, as well as an overview of penalties that might be incurred, developers and actors might be subject to if they are found to be info blocking. So this is very important. We encourage you to review this information in order to remain compliant. The ONC has also hosted a few webinars specifically addressing the subject of information blocking, and they are available on the ONC Cures rule page. So definitely take a look at those. Real-world testing, so this is a new requirement, applies to developers whose products are certified to interoperability criteria as of August 31st of the submission year. So this will include criteria B1 through B10, C1 through C3, E1, F1 through F7, G7 through G10, and then H1 to H2. Obviously, a lot of criteria, so this requirement, this condition will apply to most of our developers. The API condition of certification applies only to developers whose products are certified to API criteria, G7 through G10. And then the remaining three conditions listed here, assurances, communications, and attestation, will apply to all Health IT developers. We hosted a webinar previously called the Conditions of Certification and Surveillance. So that webinar provides further details on each of these conditions and their requirements. So you can access those on our Drummond website and take a look for more information. We received a number of questions about how to obtain a Cures certification designation. So we wanted to provide some examples here. So first of all, the product must satisfy all applicable Cures related criteria within the certification listing. So if you take a look at example number 1 in the box below, It shows a product certified to several criteria. And in this example, the developer is only choosing to attest to one of the revised cures criteria. Because there are other cures-related criteria that still need to be revised, this product has not yet met the, or is not yet eligible for the cure certification. If we contrast with the example number 2, example number 2 highlights a product certified to a different set of criteria. And in this example, the developer has attested to meeting compliance for all of its cures-related criteria within that particular certification listing. So for example 2, that product is eligible for a cures certification designation. The product in example 2 would receive a new Drummond certificate along with the cures certification seal for marketing purposes, and the product listing will be updated on the chapel to indicate that it is a 2015 cures update.
Great, Sonia. Thanks for that overview. And again, this will be emailed, so you'll have those resource links to review. Let's transition and talk about the expectations for those that have the 2015 edition certification. Will you go into more detail on what they should expect?
Right, so this is for products already certified to 2015 edition. So we want to clarify for these products, it will not require a full recertification. Rather, only 4 new criteria have been added, as presented in the previous slide, as well as some revisions to some of the criteria. So as far as retesting, live testing is only going to be required for 1 new criterion, and that's the G10 standardized API. So developers whose products are affected by G10 will need to schedule test time once they're ready. And based on our pre-testing activities, we anticipate approximately 3 hours to test G10. All other new and revised criteria are attestation-based. So this means developers will self-test those other new and revised criteria and submit a signed attestation stating that your product meets compliance. Drummond has created an attestation form for developers, and that form should directly be submitted to the certification body. Form from you, the certification listing may be updated. Also, the update criteria are not expected to be too much heavy lifting for most developers. They're intended to build upon existing 2015 capabilities. And then finally, if a product has never been certified to a particular criterion that's designated as revised under cures, then live testing might be required. And what I mean, let's take an example. Consider a product that was never certified to B3 prescribing. Well, B3 is revised for cures. But if the product was never certified to B3 under 2015 edition, that product is not eligible for attestation, and that product should be live tested against B3 by an ONC authorized test lab. Now, this next slide summarizes the actions that developers will be expected to take. Again, just to reiterate, so this, again, only applies to products already certified to 2015 edition. So live testing required for G10 standardized API. So if this applies to your product, you will need to register, schedule some test time with the proctor. If the, again, the API criteria applies to your product, you will need to test and certify G10 by May 2022. Next, we identify the remaining new and revised criteria. Again, these are attestation-based. So once the updates are implemented in your system, developers will self-test and submit the Drummond provided attestation form. This form is available for download in our Drummond customer portal. And you can also request this form by emailing us at certification@drummondgroup.com. And registration will be required in order to attest to any of the new or revised criteria. So just a couple of footnotes here. As I briefly mentioned earlier, the product has to already be certified to the revised criteria in order to be eligible for some of those attestations. And then additionally, the attestation for B3A prescribing, it's a little bit different in that it not only requires the attestation form, but it also requires that developers self-test using the NCPDP test tool. Developers will then submit the validation reports from the tool along with the signed attestation form to the certification body. And you can find more information about the tool from the ONC's test method page under the B3 criterion. So next steps, again, for products already certified to 2015 edition. So we reviewed what the testing and recertification expectations are. So once you have implemented these updates and are ready to recertify, step one, just making sure you have reviewed the ONC and Drummond resources, specifically using our proctor sheets, the attestation form, and then obviously if you have any technical questions, you can continue to rely on the support that we provide here at Drummond by submitting a ticket from the portal. So you've gone through the resources. Next step is to, as a reminder, to please sign the digital contract issued by Drummond in early July. This agreement, it includes our new pricing model. An executed copy is required before any 2015 edition or 2015 cures testing or certification engagement. So this applies across the board, regardless of the engagement type, whether it's 2015 or cures. We do kindly ask that you execute that and return to us before registering. If you have any questions about pricing or contracting, or if you didn't receive your new contract, please contact us at ehr@drummondgroup.com. So once we've gone through these steps, the final step number 3 is to register. So registration is required when wanting to certify to any new or revised cures criteria. So developers have 2 options. You can request these updates via your next quarterly attestation. We will update some of those questions and make sure the forms are available within your quarterly attestation module. The second option is to register online. So at any time, developers can register using our online form at drummondgroup.com. And just as a reminder, when registering online, if you are adding or changing certified capabilities, please select that particular service option. A common question we've been hearing is how much this is going to cost. So we wanted to provide an outline of some of the anticipated costs. Note that the actual pricing is available to Drummond clients by downloading our decision guide from the Drummond website or by accessing it within our customer portal. So here we provide an example based on a product already certified to 2015 edition with plans to attest to revised criteria by 2022. So these are the anticipated costs for this product. So beginning later this year in 2020, this product or its developer would be required to submit the real-world test plan. So a fee would be incurred for the real-world test plan submission. In 2021, at minimum, Drummond developers can anticipate your usual annual certification surveillance review fee, which is the ACSR. That's due in January. This covers limited surveillance activities, quarterly attestations, and the new biannual attestation review. And we'll get to that one in a moment. Then also in 2021, your next real-world test plan will be due in December. So at minimum, 2021, you'll have 2 anticipated costs to maintain your certification. Then in 2022, the minimum anticipated cost, again, we have the ACSR fee in January. Then a certification fee will apply when attesting. Using this example, if that's May 2022, that's when the cert fee would apply. And then later, the first set of real-world test results will be due in March of 2022. I think we got that out of line there. But March 2022, your real-world test plan, your real-world test results will be due, and there is a fee for that test result submission. And then finally, in December of 2022, another set of real-world test plans. So overall, in this example, we have 4 anticipated costs for 2022. A couple of footnotes here. So this example only includes some of the minimal testing and certification requirements that are expected to incur fees. So this example does not demonstrate the full compliance timeline for all the required conditions. We've tried to carve out only those that would incur an anticipated fee. And then a reminder, so if there were no non-compliance findings for your product issued in the previous year, then the product is eligible for a 10% discount on that January ACSR fee. And as a point of clarification, any self-reported nonconformities by the developer will not impact that discount eligibility. So if you were to self-report and a corrective action were to result, you could still be eligible for the discount.
Great, Sonia. So let's talk about the developers that do not have a 2015 edition certification. Will you talk about how they get started, what they should expect to test, and when?
Right, so in this next section, we'll discuss expectations for developers with products not yet certified to 2015 edition. So for these developers, you can request the Drummond Criteria Selection Framework. So this is a guide developed by Drummond to provide assistance in selecting test criteria as well as scheduling test time. Step 2, these developers can schedule a call with our client services team to review onboarding expectations, fees, an overview of the technical support that we provide, and to schedule a call with our client services manager, Tracy Rue, is the Calendly link that is provided here in this slide. Step 3, registering. So you can register using our Drummond website. Registration form is available. Once you have registered, someone will contact you to provide contracts and pricing based on your specific test plan. And then finally, step 4, once the contract has been executed, administrative fee has been collected, the enrollment will then be complete. And at that point, you will be assigned a test proctor and will be granted access to our customer portal, including the test script, knowledge base, support ticketing system, and then from there on, you'll just continue to work with your test proctor and schedule testing. So we do have some testing reminders that we want to share for these new products, the certification program. So because the product is not yet certified, obviously many of the criteria would be required to be live tested. And so those criteria are identified within the Drummond Criteria Selection Framework that I mentioned in the previous slide. There in the framework, you'll see if it's attestation, self-declaration, or if live testing is required. Please note that GAP certification is no longer available since 2014 edition has been retired. However, most of the previous GAP eligible criteria are now designated as self-declaration, meaning you will self-test and submit a signed attestation to meeting compliance. You'll notice when reviewing the ONC test method page that some criteria are part of both the 2015 edition and the 2015 edition Cures update. So while developers can opt to test either method, we highly encourage developers to seek testing the Cures updates as soon as you can, keeping in mind that the May 2022 compliance timeline will also apply to newly certified products. As we briefly mentioned today, the product must first satisfy all applicable Cures-related criteria before a Cures designation can be granted. So this table summarizes the testing and certification expectations related to Cures for products not yet certified to 2015 edition. So this is just to reiterate, again, many of the ONC criteria will require live testing since this is initial certification. So you will need to schedule some test time with a proctor, with the exception of the criteria that's listed under attestation and self-declaration section. So again, those could be self-tested by the developer and then submit the signed attestation form to your proctor. You'll notice some of the new Cures criteria are attestation-based, so even for products not yet certified to 2015, again, there will be some cases like these where you will self-test. And you can determine which criteria are attestation-based, again, by visiting the ONC test method page or using our Drummond Criteria Selection Framework. So anticipated cost for an initial 2015 certification this year with plans to attest to revised criteria in 2022, okay? And again, as a reminder, actual pricing is available to Drummond clients through our decision guide with our portal. So in this example, this product newly certified to 2015 edition in September of 2020. So obviously the initial test and certification fees would apply, but you'll notice that this developer would not be required to submit real-world test plans this year, since real-world testing is based on criteria certified as of August 31st of the submission year. Now in 2021, at minimum, this developer can anticipate the ACSR fee in January. As previously noted, this fee covers limited surveillance activities, as well as the attestation reviews for certification maintenance. Then later in 2021, December 2021, the first real-world test plan will be due, and this will cover real-world testing that is to be conducted in 2022. So at minimum, there are 2 anticipated costs to maintain the certification in 2021. Now moving on to 2022, the minimum anticipated costs, again, we have the annual ACSR fee in January, a certification fee in May to attest to revised criteria, and then the next real-world test plan, which would be due in December of 2022. So in that year, we only have 3 anticipated costs in order to maintain certification. So similar to our other slide, a couple of footnotes. Some of these, this example includes some of the minimal test and certification requirements that are expected to incur fees. So this example does not demonstrate the full compliance timeline for all required conditions, but rather only those expected to incur fees. And then a reminder that if there were any no non-compliance in the previous year, then a 10% discount may apply to your ACSR fee.
Thanks, Sonia. So we've reviewed how to get started, the expectations for those that have a 2015 edition certification, and then the expectations for those that do not. Will you now talk about the compliance timelines and requirements?
Yes, and so if you've attended our other webinars, you've seen this slide before, but just to reiterate and drive home importance here. So the 2020 requirements for developers, we wanted to highlight some of the compliance requirements for this year. So effective June 30th, the assurances and communications condition certification, that is the compliance start date, June 30th. And this is for, the assurances is for developers to ensure that their health IT product conforms to the full scope of certification criteria. Now, please note this will be tested too as part of your first attestation, which will be due in April 2021. And so we'll also touch on that shortly in the webinar. So no documentation is needed to be sent to Drummond. Rather, you are simply starting to comply with the assurances, as well as communication. This is where developers are not or should not restrict user communications regarding specific subjects, such as the usability of the EHR or complaints, things of those nature. So that was, again, compliance date effective June 30th, 2020. Then later in 2020, the other communication condition is the notice to all customers with contracts containing provisions that contravene the rule. So if any developer currently has contracts with clients where restrictions are implemented, beginning in 2020, that developer should send a notice to those customers that that part of the contract will not be enforced. That is annual requirement until the contract can be amended. Starting in November 2nd, 2020, the compliance date for information blocking assurances and API compliance. So for information blocking as of November 2nd, developers must comply and should not be info blocking, and that is based on the limited EHI definition, which is limited to the US CDI. Additionally, for assurances, the developer should provide assurance they will not take any action constituting information blocking. And then for API compliance, if the product is certified to any API criteria, developers should be sure to update business policies and revise any API documentation to comply with section 170.404 of the final rule. Now, the real-world test plan, we have shifted the due date. Previously, in other webinars, we communicated a November 15th due date. However, because of anticipated guidance from the ONC, and also from Drummond, we've shifted that due date to December 15th. And as a reminder, the test plan will be required for any product that has interoperability criteria certified as of August 31st of this year. In the footnote, you'll notice the enforcement discretion. So this would apply to all of the dates that I just mentioned. Enforcement discretion was instituted by the ONC to allow developers who are impacted by COVID an additional 3 months in order to comply with the compliance timeframe. And so this is just an overview on the test criteria timeline for 2020. So just to let you know, effective June 30th, developers may begin testing to new criteria and also may begin to update to revised criteria and standards. It's not required that developers do this in 2020, but just to let you know, the testing is open. Also, effective June 30th, we are no longer certifying to any removed criteria, which are listed here on the slide. For 2022, there are some time-limited criteria that will be removed, A10, A13, and E2, and that will be effective January 1st, 2022. So those will no longer be certified at that time. And then in May 2022, this is the date that most of the new criteria needs to be certified, as well as all of the revised criteria and standards need to be certified. Additionally, at that point, G8 API data category requests can no longer be certified. And again, enforcement discretion will apply. Developers will have up until 3 months after May 2022 to comply with those requirements. And then finally, May 2023, at that point, we will no longer be certifying to B6 data export, but developers must certify to B10 EHI export if the product stores electronic health information. Again, enforcement discretion would apply. Removal of limitations and disclosure. So as part of meeting compliance to the condition certification for assurances and information blocking, the CURE's final rule requires removal of some technical limitations. So effective June 30th, developers should have, or not already, should begin to remove any technical limitations from their mandatory disclosures that are posted on your website that may interfere with the user's ability to access or use the full scope of certified criteria. Additionally, on November 2nd, developers should remove any technical limitations that may constitute information blocking. Okay, so keep in mind some of these limitations that developers implement are used for transparency into the use of their certified product. And so for those types of limitations, those may continue to be cited on your website, as long as they do not interfere with the user's ability to use the full scope of the certified criteria and do not constitute information blocking. Also note that costs and fees, those types of disclosures are still required to be made public on your website. So as before, you're not required to cite the exact dollar amount, but rather just a brief description of the anticipated cost associated with the use of your product. For more information regarding removing technical limitations, please see our blog on our Drummond website titled Changes to Your Costs and Limitations. So a lot more information in that blog post, and the link is available here on the slide. As a reminder, the 2014 edition has been retired effective June 30th. So the ONC has already retired all the 2014 listings on their Chapel website. The edition is no longer used by any CMS program. Also, GAP certification is no longer permitted since those were dependent on 2014. So what does this mean? So developers do need to take action, as you are required to ensure any reference to 2014 edition has been removed from your website and marketing materials. Also, developers must communicate this to clients to ensure they understand if they are using a product version that was only certified to 2014 edition, that product is no longer considered actively certified under the ONC Health IT program.
Thanks, Sonia. Now I know real-world testing is a hot topic right now. After ONC provides that clarification, we will have another webinar on real-world testing, and we'll email everyone on this and let them know. For those interested, we do have a webinar on this topic posted on our Health IT resources page, and it's on our customer portal. So I'll send a link in the chat in just a moment. But Sonia, will you give an update on real-world testing?
Right, thank you, Melissa. So as an update, again, the due date for the real-world test plan has moved to December 15th. And so this is in anticipation of additional guidance from the ONC later this year. And also keep in mind that the test plan that you're submitting December 15th is pertaining to any product that has criteria certified, interoperability criteria certified by August 31st of this year. So if you are certifying a product after August 31st, then likely you will not need to submit a real-world test plan. You can check in with your test proctor to verify that. Also, test plans submitted in 2020, this year, will cover testing that's to be conducted in 2021. So that's just a reminder. And then the testing you conduct next year, you're going to submit those results by March 15th of 2022. So you have a little over a year to conduct your real-world testing. As the footnote mentions at the bottom, again, the enforcement discretion does apply. So our test plan due date is December 15th. But since the enforcement discretion does apply, the final due date to submit will be February 15th. Okay, so this is to allow that additional time. Again, if developers need it because of any impact from COVID-19, you can exercise that enforcement discretion. So in the rule, you've seen March 15th as the due date to have the test plan posted to the ONC Chapel website. That is true. And also, as the regulation points out, ACBs do need additional time to collect, review, and do the administrative part to actually post that to the ONC website. Therefore, Drummond has designated that final due date as February 15th. If any submissions were sent after February 15th, there may be a risk of not meeting that final date to get it posted to the ONC website. So please do not do that. Do your best to submit it early. We are encouraging everyone to try and submit by December 15th in order to allow time for us to review and get back with you if there are any edits that are needed. But if need be, consider February 15th that drop dead date to get us that real-world test plan. So as I mentioned, additional guidance is coming soon. Drummond is working on a template and a checklist for developers, so developers can better understand what is expected to be in the test plan. Our target date to release that will be the end of September, so about another 4 weeks. We're looking to get that to you. We are still working with ONC. We encourage you to continue sending in those questions. And so, again, they are also anticipating to release guidance later this year in 2020, but we do not have that target date from them. As far as the updates that you're making, or what to test as far as your real test plan submission, be sure that if you are updating to USCDI or using the standards advancement process, you need to submit that to us here in your certification body. You can do that as part of your quarterly application. And then once you submit that to us, notifying us that you will be implementing USCDI or you will be implementing updated standards, then be sure to incorporate that into your real-world test plan. Okay, again, that's if you are updating USCDI and the standards advancement. That is not a requirement, but it is available for any developers who are ready to pursue that. And then finally, the Drummond Railroad Testing Professional Services. So we have touched on this before, but Drummond is developing a new service line to provide a test plan review and test result coordination for developers. This is a separate part of Drummond, and so they will be launching that service by the end of September. And so they are still finalizing that process and what the service is going to look like, and as far as the pricing. So for more information, or if you have questions about real-world testing, please contact our interoperability director, John Velukovich. His email is there, and I'm sure that's going to be used quite a a bit in the next coming days. So real world testing is certainly a hot topic here. All right. And I'll send it back to you, Melissa. Thank you.
Yeah, so thanks, Sonia, again. Heather, I know that you have been answering some of the questions live during the webinar, but were there any that you wanted to address? We've got about 5 more minutes here on the webinar, so I'll let you go ahead and take it away, Heather.
That was a lot of really good information, so there's a lot of really good questions. So the first one is my quarterly attestation still needed?
Yes, the quarterly attestation is still a requirement. And so developers are still required to attest to any changes made to their certified technology in the previous quarter. So that quarterly attestation requirement will remain as is. As many of you know, there is a new condition of certification called attestation. So this will require developers to attest to meeting compliance to all applicable conditions of certification for the previous 6 months. So this will be a biannual attestation. The first one will be due April 1st, 2021. So keep in mind, this new biannual attestation will be in addition to your quarterly attestation. We will provide developers a way to submit these using a Drummond customer portal, and it's similar to the quarterly attestation process. So more information to come, but your quarterly attestation not changing, still a requirement.
Great, thank you for that. And there's also one related to the enforcement discretion. How do I notify Drummond that I will be exercising the enforcement discretion for conditions of certification?
So as a reminder, the enforcement discretion policy instituted by the ONC allows developers up to 3 additional months to comply with any of the compliance timelines if the developer is impacted by COVID. We will be developing a way for developers to notify us if you will be planning to exercise that enforcement discretion. We anticipate it to probably be similar to your quarterly attestation submission, where you log in and be able to answer a question. As that is finalized, we will notify developers, but so more information to come on that.
Okay, perfect. As a quick follow-up, there were several questions in there just related to where the enforcement discretion applied. Like, did it apply to the criteria changes, or is it just the conditions of maintenance? So there were quite a few questions around where the enforcement discretion applied to.
Okay, yeah, great question. So we'll start here. So the enforcement discretion does apply to the conditions of certification, but and also to the testing criteria timeline. So just real quick, I have up on my screen the conditions of certification that are in 2020, and you'll notice each has that asterisk. So again, enforcement discretion does apply for those conditions of certification. So all of them essentially. And then in our testing criteria, for example, May 2022 is the compliance timeline to revise, to recertify, to revise, and new criteria. Again, the enforcement discretion would apply here. So developers could potentially have up until 3 months after May 2022 to revise to certify, to revise our new criteria. So it does apply to both testing and conditions of certification.
Great, thank you. Yeah, there was a lot of questions, and I wanted to make sure that we answered it appropriately. There was also some questions about the real-world testing, and if you could give them a little more detail on real-world testing, use cases, timing. There was a lot of questions around if I'm new to certification and I'm not certified yet, does it apply to me? So just a little bit of background on that as well.
Right. So again, Drummond is finalizing plans to release a template and checklist for developers. So this will provide guidance to developers as what type of information to submit to us. I would highly suggest developers to start thinking about how you want to prepare your test plan. And then once you receive our template and checklist, you can just perhaps refine from there. Also, as a developer, we would suggest you to come up with some use cases. We will do our best to provide some samples, but certainly depending on your production setting, your client base, we would look to you to determine what those use cases would look like and would be appropriate for your product.
Sonia,
Excuse me.
John V checking in. One of the panelists here, team,
Yes.
real world testing obviously
Thanks,
is in
JV.
my wheelhouse. Just a note there, a fair amount of these questions, we answered them live. A fair amount of, geez, I really could use a nice little starting point for preparing my real world testing plans. We recently updated our knowledge base about a month ago with one specific world testing. And then we, through our sources here and conversations with ONC, did get a couple of clarifications, not as much as we would like, but we continue to push for that in the guidance that's supposed to come out in September. But there is a V2 of the real world testing outline, plan, recommendations, FAQs in the knowledge base. So again, recommend all customers get on the portal and review that. We've been talking to customers, a fair amount of them have started down the road and preparing their test plans, and the questions have been good. And we focused those pre-template. Again, encourage folks to get into the knowledge base and review the real world testing article. Thanks, team.
Thank you, John. And for the audience, that was John Velukovic, our interoperability director. So thank you for chiming in on that. And then I think last part of the question, Heather, was as far as new products or newly certified products. So as a reminder, the real world test plan that's required this year will be required for products certified to interoperability criteria. Those are identified here in the slides, but also obviously in the regulation. And then also, those criteria that are certified as of August 31st. So if it's a brand new product getting certified after August 31st, then they would not be required to submit the real world test plan this year.
Thanks, Sonia. And we actually have time for one more. And I just wanted to address one quick question. Somebody just asked about the knowledge base that John mentioned. That is for our clients, and it's an additional resource that we provide on our customer portal. And I put that link to the portal in the chat box. So if anybody needs that link, it is there. And that's just an additional thing that Drummond provides. So Heather, is there one more question we could wrap it up with?
Yep.
Melissa, before we do that, just real quick, in regards to access to the customer portal, if someone, if you have a team member who does not currently have a login, you can email us at certification@drummondgroup.com to request access to the portal as well.
Great. There is some questions about when people can start to register and how far ahead they can register. If they plan to maybe self-attest sometime in 2022, how soon is too soon to kind of start that process?
Yeah, so if they are an existing client of Drummond, they can take advantage of the support that we have via our portal now. And so I would encourage them to do that. But as far as registering, I would probably suggest maybe 30 to 60 days out, preferably maybe 30 to register. Typically, I would say for a new client, new to Drummond, you can register early on to take advantage of that support. But once you are already a client of Drummond, that support is continuous. And so you can submit your tickets, you can go to the knowledge base, find out what you need, ask the questions you need. But yeah, for existing Drummond client, I would say preferably probably 30 days.
Great. Thanks, Sonia. Thanks, Heather. And thank you, John, for chiming in on that real world testing. Out for the recording and the slides within this next week once it's all finalized. And then if you have any questions that were submitted, we'll get back to you via email. One of our account managers or John or Sonia will get back to you depending on the topic. If you have any questions, email us at ehr@drummondgroup.com. And thanks again, everyone, for joining us. We really appreciate it. And let us know if you have any other questions. Thanks again.